Mr. Olson. My name is Lauren, and I'm with Occupational Therapy.
Hello.
How are you feeling today?
I feel okay.
Okay, that's great. Mr. Olson, I'm just going to review your demographic information and the reason for the visit today. Okay? You're 94 years old?
That's right.
Okay. You recently had a stroke that affected your speech, your concentration, and caused right side weakness?
Yes, ma'am.
Okay. I see you're wearing your glasses. Do you have your hearing aids in?
Yeah, I have them.
Okay, and can you hear me okay?
Yes.
Okay, wonderful. So let me tell you a little bit about occupational therapy. I see from your notes that communication is an issue because of the speech effect from the stroke, and communication is an occupation that you enjoy. Well, occupational therapy helps individuals get back to the occupations they enjoy doing to the best of their ability. Okay, and that's what I'm here today to do. I saw your speech therapist that you worked with a little while ago on the way out, and she told me that your new device came in.
Yes.
Okay, so I'm here to make sure that you can access it, okay, so that you continue to engage in communicating because that's important to you. So for now on, I would like you to save your voice for me and use the device to respond to anything I ask you so I can see how well you can access it and what type of extra support you might need. Sounds good?
Yes.
Okay, great. So, Mr. Olson, I see that you're 94 years old. You remind me of my grandfathers. They're also 94. They served in the military. Did you serve in the military by any chance?
Yes.
Oh, wonderful. What branch did you serve in?
Navy.
The Navy. Wow, that's so admirable. Were you afraid in all that water? I would have been terrified.
No.
Oh, so brave. Well, thank you for your service, Mr. Olson. Okay, so
You're welcome.
thank you. So, we know why we're here today. It looks like you can access your communication device well. I see that you and the speech therapist have already programmed some generic phrases to save time. Is that correct?
Yes.
Okay. Do you prefer using the new device compared to your communication board?
Yes.
I imagine so. And it
I
looks
like it.
Yes, I imagine so. Okay, so great. So one thing I do want to look at, I like that you're supporting your right side, but I see that you're kind of reaching, so maybe we can pull the iPad a little closer where you can kind of keep your arm and shoulder comfortable. What do you think about that? Is that better?
Yes.
Okay. Now the other thing I wanted to look at, of course, this table seems to work well with the material on the iPad case of keeping it sturdy so you can press and get to where you want to go. But we don't know what surface you'll use at home. Okay? The surface at home may be a little more slippery and it may slide. And because you're just using this one hand to type and kind of keep control of it, we want to make sure that it's as stable as possible. Okay, so what I would like to recommend is some material like this, which is basically just shelf liner, but it kind of sticks to the surface and it should help kind of stabilize your communication device. So, okay, so go ahead and try that. Okay, I like that you're pushing on it, you're testing it out, very good. How does that feel? Does that feel sturdier than just the table?
Yes.
Okay, great. So to start out, when we end our session today, I'm going to cut you a piece of this to take home so that you can try it on different surfaces to see if this will be sufficient in keeping your communication device stable. Because what we don't want to happen is that you lose interest in using this because it's falling down all the time or you're pressing the wrong thing because it's moving everywhere. Does that make sense?
Yes.
Okay, great. So we'll send this piece home with you today to try it out. When you come back for your next visit, you'll let me know if that worked well or not. If it didn't work well, we can probably try something a little thicker and a little sturdier like Dyson. Okay, this is Dyson. So we would just put it here, and there's better control of it. So you can try. Oh, I can even pull it closer. You can see, yeah. So once it sticks, it sticks. So you can try it. Now we have it a little closer.
I think this will be good for me.
Okay, so we're gonna start out with this, and then if that doesn't work, we will move up to trying this, and you'll take this home next time to try. Okay, sounds good?
Yes.
Okay, wonderful. So the next thing we're gonna do, it looks like you're accessing your device great, at least in the therapy clinic. I would like to do some passive range of motion exercises with you today, because your ultimate goal is that you want to, besides communicating, is that you want to be able to do some of the things you used to do on your own again for self-care. One of those things is dressing. Is that correct still?
Yes.
Okay, great. So our ultimate goal in occupational therapy is to get you to a point where you can dress independently, or at least with as minimal assistance as possible. Okay? So if you're willing, I will demonstrate some passive range of motion exercises on your affected right side. I would like you to let me know if you're experiencing any pain or if anything feels uncomfortable. Okay? Is that okay?
Yes.
Okay, wonderful. Then I will come over here, scoot behind you. All right. And these are some of the exercises, what we consider passive range of motion. They're also range of motion exercises. The difference passive is that I'll be making your arm move. Okay? Could you do that on your own?
No.
Okay. So at this time, your arm is not strong enough for you to do it on your own. So passive range of motion means that we're going to maintain everything. We don't want to lose any more muscle strength. We want to make sure that everything's staying flexible and with movement, right? So I'm doing these when you'll come see me for the sessions. Your caregiver at home can do these, okay? Does any of that hurt or feel uncomfortable?
No.
Okay, good. We can also work your wrist. Did any of that hurt?
No.
Okay. And then we can also work your fingers. Okay, so just keeping all the joints moving and mobile while we're working to build up your strength to get you back to doing your own things. How does that sound?
No.
No?
Touch good.
Okay. Okay. So this is my little cheat sheet, but I'm going to make a copy to send home, and I'm going to go over the exercises with your caregiver so she can do those with you just a few minutes a day, because I know you did indicate that you get tired sometimes. Okay? So just a few minutes just to keep everything moving, okay? And then hopefully, and I'm going to scoot back around you to show you some other things. So when we meet again, if you're doing your passive range of motion exercises at home, we can move up to doing some things like this. So how about this ball? You can touch it with your left hand to kind of get a feel for it. Okay, how does that feel?
Good.
It's good. Okay, good. So we're hoping to build up to where you can squeeze in your right hand. Because you see, I can feel that all in here. It's not just working my hand. It's working the forearm as well. So to strengthen, we can also do therapy, okay, to kind of help strengthen. And then also therapy bands. So, see, not too, you can pull this side with your other hand to kind of see. So see, not too heavy, just a little resistance, okay, to build up. So how does that sound?
I like it.
Okay, great. So then when I see you next week, we will talk about how you're doing with your communication device, if it's still easy to access, if you're having any problems. And then we will discuss how the passive range of motion that your caregiver's been doing with you at home has gone, if you've experienced any pain with that, if you feel any stronger on the right side from doing it, and see if we're ready to advance to these other things for the next session. How does that sound to you?
I look forward to next session.
Okay, that's wonderful, Mr. Olson. I look forward to working with you again as well. Thank you so much.
Thank you.